Governor Maura Healey, Commissioner Robert Gordon, and Secretary Mayhem. Uh, Many people in this community remember Mr. Mayhem because he served to the community, and people love him, and nobody forgot him. He support the community for many, many times and many years. I want to say thank you, Great Lawrence Family Health Center, for your hosting this event and continue work the, for keep the community healthy. Today, the message is very clear. Keep vaccine keep the family and neighbor safety. And that's very important, the message. Thank you everyone for being here, and God bless the city of Lawrence. And I want to introduce Governor Healey. Thank you, Governor.
Thank you, Mr. Mayor. Thank you. Thank you. Thank you, Mayor DePena, for welcoming us to the city of Lawrence. It's great to be here today with our friend, your doctor, our Public Health Commissioner, Dr. Robbie Goldstein, as well as President of Greater Lawrence Family Health Center, Dr. Zandra Kelly. Thank you for being here today, and all the dedicated providers and staff here at this great, great place. I appreciate our legislative partners, Senator Payano, great to see you, Leader Frank Moran, of course, and we also have Representative Paulino with us and Representative Reyes with us. Thank you for your partnership and your funding. And we have with us Michael Curry, who is the Executive Director of the Massachusetts League of Community Health Centers. So, look, we see outside, leaves have turned, got a little chillier this week. With that, we know that it's cold season, flu season, so it's a good time for people to go out and get your seasonal vaccines, whether it's for flu or COVID, whatever it is. I got both already because I don't want to get sick this fall or winter, so I'm first out of the gate early on when they become available. Seasonal vaccines, and my message is serious, seasonal vaccines are important. They're important because they save lives and they keep people healthy. I want everybody to know, especially folks with underlying conditions that make them vulnerable, vaccines are available in Massachusetts, and we want you to be able to have access to safe, preventative health care like vaccines that's going to be good for you. The fact is that vaccines do prevent illness and vaccines do save lives. And that's why, as Massachusetts is America's healthcare leader, we're doing everything to make sure healthcare is available to people, including them being able to access vaccines. We also made sure that everyone's plan covers vaccines recommended by our own State Department of Public Health. Cost will not be a barrier. We made sure our pharmacies continue to make vaccines available, and I want to thank all the pharmacists and pharmacies out there. I also want to thank local boards of health because you can get vaccines at local boards of health. And I want to thank our great community health centers like Greater Lawrence Family Health Center because you can get your vaccine here at a place like this great community health center. In fact, I met a gentleman who was so impressed that folks from here contacted him a while back to remind him about how to get a vaccine, made it easy for him to come in, and lo and behold, not only did he get a vaccine, but he also then made a very generous contribution to this healthcare center that's enabling great space for the 48 residents who do outstanding work here, serving 65,000 patients a year. But I do want to take a moment, and I want to give great credit to Dr. Goldstein, our Commissioner of Public Health. You know, given what he saw happening in D.C. and given what we saw happening with the Trump administration, the defunding of health care, the dismantling of the Centers for Disease Control, and the taking away of vaccines that was accomplished by Bobby Kennedy in his firing of all of the scientists and people who actually understand the science of health and the science of vaccines, they made efforts to take that away from people, but in Massachusetts, we stood up and said, not going to happen on our watch. Dr. Goldstein wrote a prescription for everyone in Massachusetts so they could get their vaccine, and then we got the insurers to cover the cost and the pharmacists to make vaccines available, and Dr. Goldstein also set up a public health collaborative with other states, a number of other states, to make sure we're doing what the federal government should be doing, which is providing vaccine recommendations that are based in science and doing things like disease monitoring and having the public health infrastructure in place and having the emergency preparedness in place. Again, these were things that the CDC, the federal government, used to do, but no thanks to the Trump administration, aren't happening anymore. But Massachusetts, we're committed to health care. We want people to be able to take care of themselves and get the care that they need. And so in the face of that, we took action. And this month, the Department of Public Health is launching a public awareness campaign because there's unfortunately a lot of misinformation out there. So we're going to get messages out across social media platforms and in public spaces to make sure that we're able to reach people about Massachusetts, to let them know they can get their vaccines. And we're going to do that in Spanish, Portuguese, Vietnamese, Chinese, Haitian Creole, and we're going to include English too. In Massachusetts, we're not going to let things stand in between patients and doctors in terms of getting the care that they need. I just encourage everybody to go out and get your seasonal vaccines that are recommended for you to protect yourself and your family. And I now like to welcome Dr. Robbie Goldstein to the podium. He wears a white coat because he still practices actually as a physician. And I really appreciate all you've done, Robbie.
Thank you. Thank you, Governor. Good afternoon, everyone. It is wonderful to be in Lawrence, to be back in Lawrence, a city that really reflects the strength, the diversity, and the resilience of Massachusetts. So here we are at the beginning of another fall respiratory illness season. And there is no better place than here at the Greater Lawrence Family Health Center to start our campaign. This is a place that embodies the heart, the soul of community care. I want to take a moment to thank Governor Healey for her steady and courageous leadership, for championing vaccination and prevention and public health, and for standing firmly on the side of science and evidence over ideology. At a time when dangerous misinformation and partisan noise too often drown out the truth, her voice has been clear, bold, and grounded in the values that have always defined Massachusetts: purpose, integrity, and care for others. This state has always led the way in public health. That's not by accident, it's by design. Our state was home to the nation's first public health officer, Paul Revere, the first state health department. Even the concept of community health centers was born here in Massachusetts, built on a radical but simple belief that healthcare should begin where people live, learn, work, and dream. That legacy is alive and it's thriving in community health centers just like this one. The health centers are the trusted front doors for more than 1 million people across our state, and they are the backbone of public health. This is where trust lives, where care is personal, and where innovation meets compassion. Community health centers deliver, especially when it matters most. So this year, as we face some familiar challenges like COVID and flu, we are also going to draw on some familiar strengths: the science that gives us safe and effective vaccines, and the partnerships that help those vaccines reach the people who need them most. And that's why we're here today, to lift up the truth and to cut through the noise, to remind everyone that vaccination remains one of the most important and powerful actions of protection for ourselves, for our families, and for our communities. Vaccines are a triumph of science. They save lives. They do it quietly, they do it safely, and they do it consistently. We're working hard to send that message to everyone in every neighborhood, in every community in Massachusetts. And so the department's statewide campaign is built on the idea that protecting your health is protecting your community. Vaccines are an act of care and connection. We know that trust, the truth, partnership can overcome fear and falsehoods. And today, we continue that work together. So as we mark the start of the respiratory season, remember an important lesson that we can learn from community health centers across this state. Everyone deserves a fair shot at a healthy life. In this case, everyone deserves 2 shots, one for flu and one for COVID. So I encourage you all, get your flu shot, get your COVID vaccine, help us spread the word that protection is power, that vaccines are available, that they're safe, they're close to home, they're free. Thank you to Governor Healey, to the incredible team here at Greater Lawrence, and to all of our community partners across Massachusetts who make this work possible. Because it's when public health and community health centers come together here in Massachusetts, we can light the way forward. We can turn science into strength and hope into action. So thank you very much. Go get vaccinated, everyone.
Good afternoon, everyone. Good afternoon. It is truly an honor to welcome you all to the Greater Lawrence Family Health Center today. I want to begin by expressing my deepest gratitude to Governor Maura Healey and to Commissioner Robbie Goldstein for their unwavering leadership and commitment to public health. Their dedication to preventative care, especially through this new campaign, demonstrates a profound understanding of what it takes to keep our communities safe and thriving. We are especially proud that a Greater Lawrence Family Health Center was chosen as the site for this important announcement. As the president and CEO of this health center, and as a practicing family physician who still sees patients right here in our clinic, I can tell you firsthand how critical vaccines are to health and well-being of our communities. Our patients are hardworking individuals and families who rely on their health to care for loved ones, to work, and to contribute to the vibrancy of our region. When illness strikes, it doesn't just affect one person. It affects entire households, workplaces, and neighborhoods. Vaccines are one of the few tools in medicine that allow us to prevent illness before it begins. They are safe, effective, and essential, not only for individual health, but for the health of our entire community. They protect our children, our elders, and our most vulnerable neighbors. They keep our schools open, our businesses running, and our hospitals from being overwhelmed. Community health centers across Massachusetts are a powerful force in this effort. With our collective reach, depth, and commitment to public safety, we lead the charge in vaccinating our communities. We are efficient, we are innovative, and we mobilize swiftly to confront serious public health challenges as they arise, ensuring that care is not only accessible, but proactive and responsive. At GLFHC, we care for our patients across every stage of life, from prenatal care supporting healthy pregnancies, to pediatric care for newborns and children, to adult medicine, behavioral health, and chronic disease management, all the way through compassionate end-of-life care. We are more than a clinic. We are a trusted partner in our patients' lives, and we are proud to walk alongside them on their health journey. Community health centers like GLFHC are the backbone of primary care in Massachusetts and across the country. We are here to serve, to educate, and to ensure that our communities have access to the care they need to live a healthy life. Once again, thank you, Governor Healey and Commissioner Goldstein, for their vision and for standing with us in this critical moment. I also want to acknowledge and thank the other elected officials here today who continue to support our mission, and the Massachusetts League of Community Health Centers for their unwavering support. To everyone listening, if you haven't received your vaccine, please don't wait. You can get vaccinated right here at the Greater Lawrence Family Health Center or at your local community health center, clinic, pharmacy, or hospital. Protect yourself, protect your family, protect your community. Thank you.
Thank you so much. And now at this moment, we want to invite a special guest up. Where's Alberto? We got a customer this afternoon. Hey, come on in, man. You're great.
Yes.
All right.
Do it.
You're going to do it?
Yes.
All right. Why are you here?
This is the shot to prevent hair loss. Oh, no, that's somewhere else. No, I'm good. No, I'm here in my favorite city, Lawrence, after Boston, because you're right, there's a lot of disinformation. So what better way than to do it yourselves? I've always been a fan of the flu shot. I think I'm going to do both. I think I'm going to do you, like you. So let's do this.
You can handle it.
If I faint, you're catching me? Because I'm
got
not.
you.
Okay, good.
I
good, let's
got
do
you.
it.
And let's, we should give a shout out to our Spanish people.
Mira, yo estoy aquí, me dice la gobernadora, porque hoy lo hablamos en la hora del café. Quiero dar el ejemplo. Hay mucha mala información. There's a lot of misinformation. Cuando yo dije que iba a venir para acá, muchas personas me decían, ¿por qué? ¿Por qué? ¿Por qué? Obviamente creo en la ciencia. I believe in the science, okay? I believe in the doctors, en los doctores. Y tengo mucha confianza en este lugar. And I have a lot of confidence over the years at this particular place. So why not do it here, where I know they do a great job, and I'm going to follow the lead of our governor and our doctors. So ahora yo me voy a vacunar. Si lloro, no le cuente nada a nadie, que me da miedo, pero vamos. All right, I'm ready.
I know you're ready. You're
Okay.
looking good. All right. We're gonna sit right down. All right. Take your shirt off, Alberto.
You just want to see me with my shirt off.
Don't we all?
Ya el tiempo me pasó, la foto veo que ahí. Alberto, you're glowing.
Tú estás en tus aguas.
All right, we're fine. I'm just gonna have to go through a few of the
Yes.
screening checklists.
Yeah.
My name's Casey, by the way.
Don't cry, please.
She did, gracias. All right, so the first question is, are you feeling sick today?
No.
Okay. The next one is, do you have any allergies to medications?